All right, good afternoon, everyone.
We can see your screen.
Oh, thank you. Welcome to the Terraces at San Joaquin Gardens Neighborhood News. Today is June 8th, 2020, and I'm Jessica Lopez, your Executive Director. We're going to go ahead and get started. So as a reminder, please use the chat feature at the bottom of your screen to ask questions, and we will answer those questions at the conclusion of our recording of this meeting. Once we unmute everyone for the questions and answer portion at the conclusion of the meeting, please mute yourself if you are not asking a question so that everyone can be heard and we can eliminate background noises. As always, we want everyone to stay safe and stay well during this time. And with that, let's go into our most recent COVID update. So as of June 6th, which is Saturday, our local Department of Public Health has reported that there is a total cases of 2,122, which is up 42 cases from the previous reporting period. Of those total cases, 64 are travel related, 994 are close contact, 812 are community spread or unknown, and 252 are under investigation. Total who have passed away with a diagnosis of COVID is 43. The total ever hospitalized is 226, and recovered is 616. The total individuals being monitored by the Fresno County Department of Public Health to date is 4,297, and those that are currently being monitored is 1,462. For the Terraces at San Joaquin Gardens, we have 0 positive cases on our campus and 0 persons under investigations or PUIs at this time. Our cumulative data to date, we have a total positive cases of 2. Both individuals have recovered, 1 team member and 1 resident. And total number of persons under investigation or PUI cases to date is 53. So current California statistics shows that positive cases continues to rise. So you can see there starting from March 16th, going up into the end of May, where we continue to still trend. We peaked right at the end of May, beginning of June, and are starting to decline a little bit. But what we will not see is the most recent unsheltering in place guidelines. Impact on COVID will really be a couple weeks from now. So it's going to be about 14 days post the end of May, where the shelter in place guidelines were lifted, to see what the true impact of that will be. So if we spike again, which it looks like based on the case count that we're seeing trend, at least here locally in Fresno County, that it makes obvious sense that as things are unsheltering and there's more human-to-human contact, that we're going to see more COVID cases. Wanted to let everyone know that on June 11th, we will be testing all residents in the Village Healthcare Center for COVID. So we are doing some regulatory required mass testing. So the Centers for Medicaid and Medicare, or CMS, have required that all skilled nursing facilities conduct baseline mass testings of all of their residents and all of their team members. So this will mean on June 11th, we will be testing approximately 40 plus residents within our Village Healthcare Center. And then the subsequent 2 days on June 12th and 13th, we will be testing all of our team members that are associated with our Village Healthcare Center. So anybody that goes into the village, even if it's a maintenance team member, they will all be tested for COVID in accordance with CDPH requirements as directed by the Centers for Medicaid and Medicare. And why are the Centers for Medicaid and Medicare and the federal government so focused on skilled nursing? Well, 28,100 residents and workers have died from the coronavirus in nursing homes or other long-term care facilities for older adults. And most of those cases, if the vast majority, are all in a traditional skilled nursing environment. So it has infected more than 153,000 at some 7,700 facilities. So even within the human good family, the only real cases of COVID that have been seen have really been in that skilled nursing environment. And that's because it's true congregate living. And so, a lot of skilled nursing environments have multiple individuals in the same apartment. Usually they represent the frailer of individuals in terms of comorbidities. So they are at highest risk for spread. So that is why the government has focused their attention on mass testing there, and they will do a baseline testing of everyone, and then they will continue to test routinely based on a percentage of the population, based on any COVID activity that occurs in that baseline time frame. As a reminder, the COVID-19 symptoms are fever, cough, shortness of breath or difficulty breathing, chills, muscle pain, sore throat, loss of taste or smell, and gastrointestinal symptoms. So as always, I know this is very repetitive, but if you are experiencing any of these symptoms, please let our clinical team know so that we can consult with you and or your primary care physician in order to determine if COVID testing is necessary. We also want to remind you to wear your mask, and that's for the safety of you and others. So please wear your mask when you are out and about on campus, going to the store, going to the doctor, when you're getting your meals, things from your message boxes, any engagement with fellow residents. And we really want to make sure folks understand the right way to wear their masks. So it is covering both your nose and your mouth succinctly so that you can make sure you're keeping those droplets from going out should you cough or sneeze. So again, why is it so important for really every citizen in the United States and beyond to wear a mask? Well, it will allow you to have the lowest possible risk of spread. So if you're an asymptomatic carrier and you don't have a mask, you're interacting with another individual without a mask, that's the highest risk of spread. If one person's wearing a mask and the other carrier is not, that's moderately high. Again, if that COVID carrier was a good citizen and wore a mask and was talking with a healthy person without a mask, that's low. But the best case scenario, the one that we really want to make sure everybody understands, is that if somebody had COVID-19 and they were wearing a mask and that healthy person was wearing a mask, the risk of spread is very low because you are keeping those droplets from spraying out where other individuals could inhale them in. In fact, when the health department is doing their contact tracing, not only are they asking individuals who test positive for COVID where they have been, but they're also asking them to, if they were wearing a mask, and et cetera, during these interactions, because if they were, there's a very minimal chance for spread. We created a fun video to share with you all about how to properly wear your mask. So let me click on this, and this is also on YouTube and will be featured on, sorry, hold on. Full screen is unavailable.
Try clicking on it again and use the grab bars to make bigger.
That's not doing anything, Michelle. All right, well, this video will be on Touchtown, as will it be on in the YouTube for Terraces at San Joaquin Gardens. So if you can, please check it out, because we do want to make sure that you see it. It features a lot of our team members and a lot of faces that you will recognize. No, it's not letting me move forward. There you go. We want to really continue to highly recommend that you wash your hands at all times. And this is, again, one of the biggest preventatives for if you touched somebody, or you got droplets on your hands and then you went to touch your eyes, nose, or mouth, if you had washed your hands for 20 seconds prior to get that COVID off of your hands, you're not going to accidentally infect yourself. So you really can't wash your hands enough right now. And certainly between that social distancing and wearing your mask, you're really going to help keep yourself and others safe. Again, physical distancing is so important with the respiratory droplets. And, when somebody sneezes or coughs that out, or even speaks, or, that's why it's so frightening to see a lot of these, the social unrest and the protests that are occurring, is because there's so many people that are standing close together and they're shouting. And that projecting is putting more droplets out into the air for other people to breathe in, which can obviously spread COVID very rapidly. So it's really important for folks to stay at least 6 feet away from each other, both wearing masks. That's incredibly important to keep that transmission to a minimum. So again, 6 feet apart is the rule. I was even noticing in our last garden news that went out today, in the pictures, again, I think people think they're 6 feet apart, but picture me. I am 6 feet basically or more when I'm wearing heels, and the more the better in terms of distance. And people aren't staying 6 feet apart, and so it's quite a distance when you think about it. So we really want people to make sure they're staying that physically apart when they're interacting on campus. Again, as a reminder, if you decide to get tested, even just because you have no symptoms, you're just curious, please let us know so that we can track your symptoms and be aware that that COVID test is pending, as well as any symptoms that you might have. As you know, the state of California is in stage 2 of the reopening process. They are quickly moving to stage 3. That was very surprised. I've been surprised this whole time about how quickly they're moving things, but they've recently announced that they are moving to phase 3 and are allowing schools to start back, as well as bars, etc. I believe that the guidelines for that are being released this week. So those will go into effect this week. So we are quickly moving from stage 2 into stage 3 for the state of California. Again, the state may move back to stage 2 if our COVID rates increase dramatically across the state. Right now, we are in phase 2, and we are also quickly moving into phase 3 of our reopening guidelines. So right now, we have meal pickup happening, and we are working very quickly to look at some visitation, some activity, and some other things in phase 3 starting. So I'll go through that a little more in detail. So again, as a friendly reminder to everyone, that our shelter-in-place restrictions are not only dependent on what the city, the state, and the county are doing, but they're also dependent upon the other regulatory agencies that oversee us, including the Department of Social Services, the California Department of Public Health, the Center for Disease Control, and the Fresno County Department of Public Health. That's a lot of alphabet soup, a lot of acronyms. But these are all the regulatory bodies that we look to for guidance as we develop our structure for reopening. So what does that mean for us? As you know, as of the 4th, we went to pick up dining. We are expecting this week, if not today, to hear from the Department of Social Services, who would allow activities, visitation, gym, etc., to be approved for reopening. So even though the state of California says that gyms can reopen, we have to get our guidance from the Department of Social Services, who has told us that they will get guidance to us this week. And they said Monday, but we haven't seen anything come out yet. But again, we are expecting those to come through. The pool, we are still waiting on Fresno County to release restrictions on community pools. We're actually going to reach out to them to advocate that they allow us to open a pool, because we are very different from an HOA. And that pool is really used for almost like a therapy for our residents in terms of their physical needs. So we're trying to push that through. Our salon will be back open on June 9th, tomorrow, June 9th, and I'll talk more about that shortly. And then transportation, we have approval to begin utilizing transportation, and I'll speak more to that in a moment as well. So our Spa Bella is open. So as of tomorrow, our Spa Bella will be back open for full services with the exception of nail care. The state has still not given guidance for nail salons in terms of doing painting and manicures, etc. So let's start with the top, which is Spa Bella will be open Tuesday through Saturday by appointment only. We will now be doing haircuts, hair coloring, perms, barbering, in addition to shampoo and sets. Barbering services will be announced based on his schedule. So when the barber can be here, and we'll get that notice out for all of our gentlemen. But if you don't want to wait for the barber, you can certainly have Pam help you in Spa Bella. As a reminder, the team member and the resident must wear a mask at all times. No services will be allowed if a resident shows up without a mask, or they want to remove their mask. We'll have to stop our performance of duties until the resident agrees to wear the mask during the whole time, which can be awkward, I know, during the shampooing, etc. Only one resident at a time for the hair salon needs. They must maintain a 6 feet distance with the nail service station. We've indicated a 6 foot gap on the floor so that we have a clear marker for residents. So if somebody's getting their nails trimmed versus somebody getting their hair done. Do not come to the appointments early. That is actually a city requirement. You're going to be asked to sit outside of the salon, and you'll be called in once the other resident has left, so that the area can be sanitized prior to you coming in. So it's important that when you make your appointment, you show up right on time and not too early, which I know is hard because all of you are so good at coming to everything early. Again, the most recent announcement allowing for hair salons to reopen did not include nail salons. So we still are only allowed to do hygiene related tasks for nails at this point. And once more information comes out in regards to that, we will let everyone know. Transportation. So we do have guidelines for transportation during the COVID. It requires disinfection between each rider. Protective wear must be worn at all times while in the vehicle, so meaning that mask must be on. Boarding process, one resident or two of the same household are allowed in the vehicle at a time. The difference with the bus loading and capacity will be changed, obviously, because of COVID. Appointments still are required to allow the driver to transport one resident at a time to and from, so we might not have as much availability as we've had in the past because of that. And we ask for your patience and rescheduling appointments, because we do have these restrictions that we have to follow in terms of only allowing a certain number of individuals in the vehicle and the infection control process in between. So when will we have the tram running again? I know that's been on a lot of individuals' minds, especially as we look to this warmer weather. And the answer is very, very soon. So we are expecting by the end of this week or early next week to have our tram up and running. This again will be modified. So we are putting plexiglass shield dividers between the seats. And that way we can take more residents at one time, and we can disinfect between each use. Again, all residents must wear masks. So right now the team is putting these plexiglass dividers in that will separate each seat from one another. That will allow us to take up to 5 individuals with us on the tram. And then once they get out, the tram driver will then have to go, sanitize all the seats and the plexiglass and leave. So again, we ask for patience and understanding that that tram won't be as quick as what you're used to, because that's a lot of infection control guidelines and time it will take to disinfect between each voyage. So we ask for your patience during this time as we have to disinfect between each use. And as a reminder, we ask that all residents wear masks during this service as well. So this is one piece of plexiglass that they have going in, and then plexiglass will also be going in front of the individuals to prevent, again, that spread of droplets if somebody sneezes or coughs on the tram. So we're asking that all TSJG committees and activities work with the EDICT team here on campus to come up with what their new normal will be for hosting activities during this COVID period, in anticipation that the Department of Social Services will allow the resumption of activity on campus. So we will be creating a form that all of the chairs can use, as well as our team members, in determining what the new normal will look like. This will help us understand if there's any services or interruptions that we should expect, or if there's any supplies needed, much like looking at that tram, we had to go in and physically make modifications. Are there going to be other physical things that we need to put in place prior to getting one of these activities up and running again? So more information to come, but both from Dennis Pager and myself on this, as we work with all of the chairs of the resident council, as well as our activity team, to plan for the resumption of activities in a modified way to prevent community spread of COVID. So that's essentially what I just said in terms of the process that we will go through. And what I want everyone to know is we will communicate weekly through this format predominantly, but also through Touchtown and Garden News as we look at adding on activities. So much like I announced today about Spa Bella opening and what that'll look like, we will make those announcements in regards to every activity as we bring it on. And we will do this in a very orderly fashion, meaning we're not going to resume all activities at once. We'll roll 1 to 2 out per week so that we can properly man it, observe it, see how it goes, learn lessons from that to take into account for that next activity, because slow and steady wins the race, especially when you are fighting a disease like COVID. We need to be very measured in our response and not take unnecessarily big steps at this time. So we really will be very thoughtful as we approach the post-COVID activity in terms of the unsheltering in place. I shouldn't say post-COVID, we're still in it, but as we look at unrestricting, we're going to be very measured and slow in our pace to make sure that we do so in a thoughtful manner. We've had some individuals not have their pendants on them and during emergencies, and we just want to do a friendly emergency reminder that in all true medical emergencies, call 911 immediately from your apartment. But you could also push your pendant, pull your pull cord. I hope all of you know where your pendant is, and that if you're not wearing it, it is very readily accessible, because my understanding of emergencies is most people don't plan for them or don't schedule them, and they just happen to them. So it's really important that you wear that pendant so it's always with you should you have a medical emergency. Press that pendant, call 911. In your bathrooms are a pull cord, so pull that pull cord. If you don't know where your pull cord is, go to your resident reference finder and look in there, and it has pictures of it. If you have any questions about any of this, please give us a call, because it is something we really want to hammer home, because we want muscle memory to take over in terms of when you're having a medical emergency. So, you know, make sure you orient yourself to where your pendant is, where your pull cord is, you know, where your phone is to call 911. And then, of course, if possible, leaving your door unlocked so that we can quickly come and assist you, and or the paramedics can quickly come and assist you. reminding you about the power of the pendant. You know, that pendant will continue to go off until somebody comes and resets it. It is so important for us, for you to push that so that we are aware. I've had residents call and say, you know, no, it took 25 minutes for somebody to come and check on me. And I can tell you down to the millisecond how long it took somebody to reset that pull cord. So, and that pendant. So please, please, please familiarize yourself where that is. But you can also, if it's not a medical emergency and you just want to talk to the nurse, you can call the nurse's phone at 430-8243. And you can also call our security team members at 696-1910. Both are good phone numbers to have programmed into your cell phone if you have one. Some questions have come up recently regarding our census and the impact that COVID has had as we've had to stop all sales activity. So our current census in residential living is 234. We are budgeted to be at 243 or 242.8. So we are below budget in residential. In assisted living, we're at 53, so slightly below budget of 55. In our Grove or memory care, we're at 27. And in skilled nursing, we are at 41. So the two key metrics there that are going to drive our budgeting process that we are obviously very concerned from a financial stewardship standpoint is that residential living census dropping so far below budget. Not only is that hurting us with monthly fees, but it's also the lack of entrance fees that we're experiencing so far in 2020 that we really need to resume sales activity and get things moving from an economic standpoint for all of our best interest. And then, of course, we've talked a lot about that skilled nursing census, and having being 10 below budget is a very financially painful thing for our community. What's going on in our dining department? As you all know, meal pickup has returned to the terraces San Joaquin Gardens. So one thing we want to make sure you know that if, although we've had lots of arrows and signage, if nobody's there, please don't feel like it's Disneyland and you have to walk through the whole line and take a parade through to go get your meal. Just go straight up there. If there is a line, however, obviously follow the directional arrows. If for some reason that meal pickup time or the location isn't going to work for you for whatever reason, just contact us at dining at 430-8228, and we can arrange for an alternative pickup time or location or delivery for that day. So the main thing is we want to communicate that while we had to make this very regimented for all of you in order to ensure that physical distancing and we didn't create unnecessary congestion has transpired, we do understand that life happens and we don't want to be rigid. So we want to make sure everybody gets their meals and doesn't feel hassled by this. So if you have any questions or you need any help, please contact dining at 430-8228. Do want to make sure that people understand when you come in the building, we are requiring that you wear masks. So you cannot enter Valencia. I've seen quite a few residents and they're very apologetic, and I know it's a new habit, but please hang your mask, you know, by your front door or keep it around your neck at all times so that you don't forget your mask, because you would just, you know, feel awful if you ended up being COVID positive and had forgotten your mask and unnecessarily exposed people. So please, please, please wear that mask so that we can keep everybody healthy and safe during this time. I think all of you have seen the meal pickup arrows and signage, and we do want to remind folks to enter and exit in the appropriate locations so that we can avoid bottlenecking and unnecessarily getting too close to one another and violating that 6-foot physical distancing rule. And this is for our bistro and our piazza building. Finally, again, a reminder that if you want meal delivery, just call us at 430-8228. If you want something from the alternative menu, the same thing. Again, just communicate with us regarding your needs. Our communication tools will be this meeting as well as Touchtown, the Garden News, and our weekly newsletter. So want to make sure everybody gets their meals in a way that meets their needs during this time. All of you should have seen this slide before, but this is the designated pickup time and location. Again, if you have a doctor's appointment during one of these times or something, just communicate with us and we will make accommodations for you. As a reminder, Father's Day is around the corner, so we have a special menu for that day, and we've already talked about it. It looks really good. I'm excited, even though I'm not going to eat it, but a big happy Father's Day to all of the fellas out there. Wednesday, June 10th is National Herbs and Spices Day. And so please look for us to be delivering some lovely fruit with some spices on it to spice up your day on June 10th. Sales update we have some new neighbors moving in. So Wayne and Bonnie Green will be moving into Milano 328. Jean Tuck will be moving into Tuscany 294C. And Betty Marisek will be moving into Sequoia 110. So get ready to welcome your new neighbors. Again, as a reminder, we need your help. This is a very tumultuous economic time. So we're going to have to work harder in sales than we ever have had to historically to make up for this lost time that COVID has, the COVID impact has had. So as we look at regaining our census and independent living, you can help us. So would you be willing to write a testimonial about what it's meant to live here at San Joaquin Gardens, not just during this period of COVID, but overall? Would you be willing to record a short video testimonial, which our sales team would come and interview you and kind of ask you a few questions and do a 2 to 3 minute video about San Joaquin Gardens and the impact that this community has had on your life and allowing you to live your best life? Or would you be willing to be paired with a prospective resident for a virtual meeting? Some of our other communities have had great success in having Zoom calls featuring 1 or 2 of our current residents talking with a prospective resident about what it's like at the community. Again, the difference is they can't experience it firsthand with tours, and we obviously can't have sales events on campus. So we're trying to get creative, and we really need your help to do that. So if any of you are interested in being an ambassador for the terraces at San Joaquin Gardens and reaching out in a variety of formats, as I just described, to help us paint the picture of what life is like here at the terraces, please contact our sales team at 430-8265. And we would greatly appreciate it, and I'll bake you some zucchini bread as a thank you.
Jessica, we have a few questions that came through the chat.
Cynthia, we'll do that at the end.
Oh, okay. Okay.
Reminder to step into fitness, and congratulations goes out to all of the participants who took part in our Step into Fitness challenge. The total steps taken were 3,630,406 for an approximate miles of 1,815. That's a lot of steps. That's really impressive, everyone. So the raffle winners will be Shirley Schlichting, which was our top walker award, Doug Kirk, Elaine Johnson, and Jim McKelvey. So a big congratulations to all of our Step into Fitness champions. We have a new Bible study group being led by Jim Westgate, Agents of Reconciliation in a Fractured World. So Thursday, June 11th through Thursday, July 16th at 4 p.m. on Channel 88. So if you would be interested in joining Jim Westgate and other residents, please join in and watch this on Channel 88. And it says, protest, violence, divisiveness, and hate have invaded every sectors of our lives. It seems like the very fabric of our society is being torn apart. How is a Christian to live when faced with this kind of turmoil? What is our role as Christians to address the chaos of our current society? This study will explore a definition of reconciliation from a biblical perspective. We will then explore how to become agents of reconciliation in the various sectors of our society. So a big thank you to Jim Westgate for leading this for our community, and we hope you tune in to Channel 88 to be a part of this. In our lodges, they were celebrating Donut Day, and they had a great time, and those are some fancy donuts. I've never seen anything quite like that. So happy Donut Day to everyone. Again, as a reminder, on Father's Day, June 21st, we will be hosting our Father's Day parade. So please tell your families that they can decorate their vehicles, make signs, sing songs, honk your horn. That really was a fun event on Mother's Day. So we'd ask that all of our residents stay on the sidewalks near your apartment for safety reasons. The parade will take place between 10 a.m. and 3 p.m. by appointment only. We might move that up because last time it seemed to go on really long and there was a lot of lull periods. So we might, based on reservations, conclude it earlier than 3 p.m. So, but as a reminder, please have your family call in if they plan to participate by June 19th at 4:30 p.m. and make a reservation at our Connect line, which is 430-8216. Everyone must wear masks and must be checked in at the screening tent, and we ask them to remain in their vehicles. So we hope everybody has a good time with that. As we spoke about earlier, prior to this call, this meeting starting, people aren't readily picking up their information from their message boxes. And so we really, really want to encourage, so if you could reach out to your neighbors and let them know. If they can't pick up their information from their message box, simply call us and we will add you to the list for us to pick them up and take them to you. So again, we really want to make sure everybody's getting those messages because a lot of important information is going out through the message boxes. A big happy birthday to some more of our June birthdays. So Diane Lundell will have a birthday on June 10th. Arlene Siegel, who I heard is getting clean carpet for her birthday, will also be celebrating on June 10th. And then Jim Thaxter will have his birthday on June 11th. So please call up these June babies and wish them a very happy birthday. Our birthday bunch lunch has been corrected. It was printed at being dinner on the calendar for in the Garden News, but it is as typical at lunch. So our next birthday bunch lunch will be Thursday, June 18th at 12 p.m. A Zoom invite will be emailed out to all the residents who are having birthdays this month, and we'll get together and have a nice surprise lunch with some cake and sing to each other and have a good time. Big thank you to everyone who has sent in information. Our roving reporters are doing a great job, so please continue to send articles, cartoons, and musings for our usage during this call, our newsletter, and Touchtown. We do need a lot of fun stuff. I mean, I think if nothing else, we need to laugh during this time and find joy. So if you find anything that is funny or fun or something that is interesting and just makes you say, please send it our way. And then also, I loved seeing in the Garden News today the poem by Joy Chittick. So again, share your own personal writings and your own creativity. You might be a poet who didn't know it, and now is the time to discover it because we have a lot of time on our hands these days. So get your creative juices flowing. Maybe some of you want to draft your own cartoon featuring our very own San Joaquin Gardens situations. But get your creativity going, send it our way. We really want to share that with everyone on campus. So please continue to send that content our way. And we really do appreciate it. It's been a lot of fun learning and growing by what you've shared with us thus far. Oh, I didn't see this. This is our first poem. Here we go. So Resident Tidbits, an ode to Jessica. When we dream about cookies and cream, we await a surprise from the baking queen. But now she's been tagged by the brass at Human Good, and she's climbing to the stars as we knew she would. We'll miss her more than she will ever know, but we must encourage her and let her grow. She has given us a very beautiful life, a place filled with joy and little strife. Thank you, Jessica, for all you've done creating this space for us at TSJG to enjoy our golden years. So thank you to a very special resident who shared that with me. I didn't know Michelle put it in here, but that's lovely. And then another tidbit resident sent us, which is have fun with the sun. For those residents who walk at a regular time, mornings or evenings, do this. Notice where the shadows are cast by the light poles, the buildings, or any other stationary objects that you see on your path. So notice where that shadow is cast on the sidewalks in front of you each day. From now until June 22nd, the shadows will move slightly south each day. After June 22nd, they will begin moving slightly north each day as the sun begins its trip from south for the summer and fall months. People doing this thousands of years ago began to realize what the sun was up to and its relationship to the seasons that were occurring each year. So a fun fact for all of you walkers out there to notice what's going on with the sun. Another funny sent to us by the resident: when the quarantine ends and you have to put on your work clothes again, and that's exactly how my pants feel right now. And then of course bees are preparing for the murder hornets, so they too are getting their necessary supplies and hoarding in case those darn murder hornets show up. So I'm glad they've got their Jim Beam. Their priorities are straight. Notice that was the first thing collected. Anyone else feel like life is being written by a fourth grader right now? And there was this virus and everyone was scared and then the world ran out of toilet paper? Yeah, and that was when there was no school for like a month and then it snowed and then we had to walk uphill both ways. And then the tigers at the top said, you told you not to use Clorox. And the white tiger says to shut up, which is a bad word in the Lopez household, but not as bad as other words my children have been using as of recent. And then finally, had I known in March that it was the last time I would be in a restaurant, I would have ordered the dessert. So we'll end with a word of wisdom from my father, Jess Tripp, which was always eat dessert first. You never know what could happen. And with that, we'll go ahead and stop recording. And actually, before we do, Cynthia, now you can go ahead and ask the questions that were on the screen, on the chat.
Sure.